Donald Trump is now running into what could be his biggest obstacle yet when it comes to reshaping the federal government, Medicare and Medicaid. NBC News reports that the official budget scorekeeper says there's no way Republicans can hit their budget goals and pass the bill the president wants without making significant cuts to one of those programs. Democrats insisting today that would wreck the lives of millions of Americans.
It will devastate children, devastate families, devastate people with disabilities, devastate older Americans.
There is simply no way to cut hundreds of billions of dollars in federal Medicaid funds without taking health care away from millions of Americans.
All this sets up a major battle for Republicans, and not just with Democrats, but against a coalition of more than 100 politically savvy and powerful organizations, including AARP. Joining me now is NBC's Julie Surkin on Capitol Hill and former Pennsylvania Congressman Charlie Dent, who's also executive director of the Aspen Institute Congressional Program. So, Julie, explain what Republicans are trying to do and why the math doesn't add up.
Well, the Congressional Budget Office, which is a nonpartisan entity that basically verifies and validates exactly how much Congress is trying to spend, or in this case, slash, had said what many Republicans have been admitting to me all along in private, which is that there is just no way that they could get to the $1.5 trillion in cuts that is outlined in this House budget bill that is championed by not only President Trump, but Elon Musk as well, without cutting entitlements like Medicaid, like Medicare. And of course, inside that budget bill are $880 billion worth of cuts that Republicans, including Speaker Johnson, have instructed the committee that oversees Medicaid to cut. The problem here is, though, as CBO, or the Congressional Budget Office, is saying, that there is no way that the math adds up on that. It's what we've been hearing. It's what Speaker Johnson himself in some ways had admitted. He said instead of cutting entitlements, they will look at the workforce, at fraud, but that still is only a couple of $1 billion, maybe 100 or 200 at that. Again, nowhere near the amount that Trump, that Musk, that Republicans have campaigned and ran on cutting out of the deficit. And then, of course, you have moderate Republicans in the House who only voted for that first step of the House budget resolution that would eventually inform the relevant committees to write the instructions, which would then fund President Trump's agenda at the border, military, immigration, those tax cuts that he's been talking about extending. That can't even happen without the votes of all Republicans in the House. Moderate members that I spoke to said they only voted for that procedural step with the intention of negotiating away how they're going to make these cuts happen. Then you have the Senate. Senators represent entire states, so it's not just small pockets of constituents and districts they're worried about. They represent states in some cases where there's an elderly population, where people really rely on these benefits and would certainly be frustrated and angry and perhaps even vote them out and cut into their margins next time around, becoming not only a logistical and practical issue for so many people, but a political calculation as well. And it is for all these reasons why we have been saying and hearing, and now, of course, is confirmed officially, that they can't do any of these major cuts and slashes to the deficit that they're talking about without actually eating into entitlements, which President Trump himself said they're not going to do.
Julie Surkin, thank you for that. Congressman, let me play what the president said when he was asked about this last week.
Can you guarantee that Medicare, Medicaid, Social Security will not be touched?
Yeah, I mean, I have said it so many times, you shouldn't be asking me that question. Okay? This will not be read my lips. It won't be read my lips anymore. We're not going to touch it. Now, we are going to look for fraud. I'm sure you're okay with that, like people that shouldn't be on, people that are illegal aliens and others, criminals in many cases. You have a lot of fraud. But no, we're not doing anything on that.
So the president says, well, but maybe fraud. Speaker Johnson has talked about reducing inefficiencies. From your time in government, is there any way there's enough waste or fraud in these programs to fill a $300 billion gap?
No, I don't see how they get the $300 billion on waste, fraud, and abuse. And, of course, there's no such thing as a waste, fraud, and abuse line item anywhere in the federal budget. If there were, it'd be really easy, but there's not. But remember what happened in 2017 during the Obamacare repeal-replace debate. At that time, when I was serving, there were also proposals to significantly change Medicaid with block grants and per capita grants. I voted against it, but it was enormously disruptive. And they couldn't pass it then with a much larger majority. I don't see how they could could possibly pass $880 billion in cuts, many of which would have to come out of Medicaid. I don't see how they can do it with this razor-thin majority in the House. And by the way, the Senate did not adopt that same approach in their budget resolution. So the House and the Senate still aren't able to agree on how to instruct these committees of jurisdiction to do their work.
Yeah, it'll be fascinating to see also what happens if it comes to a vote. 18 million Americans just over age 50 rely on Medicaid for everything from doctor's visits to prescription medication. The Economic Policy Institute wrote in part, these cuts will greatly increase hardship and misery for already struggling families. Kids will grow up less healthy and poorer, and they will make a future recession far more likely. They say even if it results in tax cuts for other Americans, it's, quote, a terrible trade. So I guess the big question is, are there Republicans who are willing to make that trade?
Well, I do think there are some, but I don't think there are going to be enough. I think there are going to be enough Republicans in the House and probably in the Senate who are not going to be able to vote for these types of Medicaid cuts. And remember, too, take a state like West Virginia. When Medicaid was expanded under Obamacare, I think about 300,000 people were added to the Medicaid rolls in West Virginia. That was I think almost 10%, or a little over 10% of the entire state population. So making these changes, it sounds easy on paper, but there are people involved. And I got in a big argument with Donald Trump over this in 2017 in the White House, kind of like the Zelensky meeting where he started berating me because I told him things he didn't want to hear about Medicaid and how it was going to impact people. And that's what's going to happen here. These members are going to hear from their constituents. They're going to say it's too much because so many people right now are dependent on Medicaid, and especially many elderly who exhaust their assets or are in nursing homes. They are also very dependent on Medicaid, in addition to those who are low-income people who are not elderly.
Yeah, there also was this little exchange in a meeting. Republicans gave Elon Musk an idea. Take all the cuts he's making, send them to Congress as a package, and then they'll help him make them permanent because, of course, he doesn't have any real supposed power. Take a listen to Senator Lindsey Graham about this.
We need to capture this in a legislative process to make it real.
Did Musk say he would do that?
He was like so happy. He didn't know it. I mean, he didn't know. I mean, that's not his job, really. Legislatively, I think he found out today that rescission is a tool available with 51 votes to lock in the cuts. And he was doing like this. Let's use it.
And when he apparently said he was doing like this, he was doing a little dance. What are the implications of this? And do you see that happening?
Well, I think I'll give Lindsey Graham credit for being transparent and at least honest about this. At some point, if we want to shutter departments, if we want to cut spending in Washington, well, there's a way to do that. The Republicans have the majority in the House and in the Senate. Introduce legislation and codify this. Put the DOGE cuts into the bills and then have up or down votes and see how it goes. I personally don't think the votes are there to pass many of these cuts. But the way it's supposed to be done is through Congress. And I think that's what Lindsey Graham is saying. And Congress needs to reinsert itself because right now, Congress's Article 1 authorities are being trampled. Their power of the purse authority is being trampled by the executive branch with this overreach. And, of course, we're witnessing many cases that are winding their way through the courts, including the Supreme Court, about what the role of Congress is in this process.
Congressman Charlie Dunn, always good to see you. Thank you.
Thanks, Chris.